What if the back pain you've been ignoring, or that your doctor brushed off as muscle strain, was actually your body sending you a life-saving warning signal? Millions of women find out too late. In the next 25 minutes, what you learn could genuinely change everything. You bent down to pick something up, maybe you reached across the counter, turned a little too fast, or simply woke up one morning and your back was on fire. You told yourself it would pass. You took some pain relief, maybe used a hot water bottle, and you waited. And perhaps it did ease off for a while. But then it came back, or maybe it never really left. Here is something that might genuinely shock you. Back pain is the #1 reason women visit their primary care doctor across the United States, the United Kingdom, Canada, Australia, and most of Europe. It is one of the most common health complaints on the planet. And yet, research consistently shows that the true root cause of back pain in women is correctly identified on the first medical visit less than 40% of the time. Less than 40%. That means the majority of women who walk into a doctor's office with back pain walk out with an incomplete picture of what is actually happening inside their bodies. This is not about blaming doctors. Healthcare professionals work hard and genuinely want to help. But there is a systemic problem in how women's pain has historically been studied, understood, and treated. And that problem has real consequences for real women every single day. Women are more likely to have their pain minimized, more likely to be told it is stress or anxiety, and significantly less likely to receive a thorough investigation into what is actually driving their discomfort. Today, that changes. Because in the next 25 minutes, we are going to go through everything your doctor may not have told you about sudden back pain in women. We are going to talk about the hidden causes that are routinely missed, the warning signs that demand immediate attention, the myths that have been keeping women from getting proper answers, and the practical evidence-based steps you can take to protect your health starting today. Stay with me because some of what comes next will genuinely surprise you. Before we get into the hidden causes, we need to talk about something fundamental, because women's backs are not simply smaller versions of men's backs. They are structurally, hormonally, and neurologically different in ways that matter enormously when it comes to pain. Let us start with anatomy. Women have a wider pelvis than men. That wider pelvis is essential for childbirth, but it also shifts the angle of the entire spinal column. It creates a more pronounced lumbar curve, that inward curve at the lower back, which puts different kinds of pressure on the vertebrae and the discs between them. Women also have naturally more flexible connective tissue. Ligaments and tendons are slightly more elastic, which means joints are less stable. That flexibility is actually a survival advantage in many situations, but it also means the spine is more susceptible to certain kinds of strain and injury. Now add hormones into that picture, and things get even more complex. Estrogen and progesterone, the primary female sex hormones, do not just regulate the reproductive cycle. They have widespread effects throughout the entire body, including on pain sensitivity, ligament tension, and inflammation. When estrogen drops during the premenstrual phase of the cycle, many women notice that their pain threshold drops too. Everything hurts a little more. During pregnancy, a hormone called relaxin floods the body to loosen the pelvis for birth, which is necessary and remarkable. But it also destabilizes the entire spinal structure, which is why so many pregnant women experience significant back pain. And then there is perimenopause and menopause. As estrogen levels decline during this life stage, bone density decreases, joint inflammation becomes more common, and the nervous system's ability to regulate pain signals changes. Women in their 40s and 50s who suddenly develop back pain that seems to come from nowhere are often experiencing the direct physical consequences of hormonal transition, and that connection is rarely made during a standard GP appointment. There is also the issue of how women experience and report pain. Research published in peer-reviewed medical journals has consistently shown that women are undertreated for pain compared to men. A landmark study found that women wait an average of 4 years longer than men to receive a correct diagnosis for chronic pain conditions. 4 years of unnecessary suffering, 4 years of ineffective treatment, 4 years of being told that it is probably nothing serious. That is the reality for far too many women, and it is unacceptable. Now we get to the part that most people have never heard, and this is where I need you to pay close attention. Because the most important thing to understand about sudden back pain in women is this: it does not always start in the back. In fact, some of the most serious causes of back pain in women have nothing whatsoever to do with the spine or the muscles around it. The pain is referred, meaning it originates in an organ or tissue somewhere else in the body, and the nervous system routes that pain signal to the back. Let us start with the gynecological causes, because these are among the most commonly missed. Endometriosis is a condition where tissue similar to the uterine lining grows outside the uterus, on the ovaries, fallopian tubes, bowel, or other pelvic structures. One of its most characteristic symptoms is deep aching, often one-sided lower back pain, particularly around menstruation. But because endometriosis is notoriously underdiagnosed, taking an average of 7 to 10 years to identify, countless women are told their back pain is muscular when it is actually being driven by endometrial lesions pressing on pelvic nerves. If your back pain reliably worsens around your period, that pattern is clinically significant and worth investigating. Uterine fibroids are another major culprit. Fibroids are non-cancerous growths in or around the uterus that affect a significant proportion of women, particularly those of African descent, who experience them at higher rates and at younger ages. Large fibroids can press directly on spinal nerves and cause radiating back pain that can be severe and debilitating. Many women live with fibroids for years without knowing it, because the symptoms are either normalized or incorrectly attributed to other causes. Ovarian cysts are extremely common and usually harmless, resolving on their own without any symptoms. But a large cyst, or one that ruptures, can produce sudden and intense back and pelvic pain that can be genuinely frightening. If you have experienced a sudden onset of sharp, one-sided pelvic and back pain, particularly with nausea or bloating, an ovarian cyst should absolutely be on the diagnostic radar. Pelvic inflammatory disease, which is an infection of the reproductive organs, also frequently presents with lower back pain. And because it can be subtle in its early stages, it is regularly missed until it has caused significant damage. Moving away from the reproductive system, let us talk about the kidneys. Because kidney-related back pain is one of the most commonly confused presentations in women's healthcare. The kidneys sit in the back of the abdominal cavity, just below the rib cage on either side of the spine. When they are under stress, the pain registers in the back, and it can feel remarkably similar to a muscular problem. A kidney infection, medically known as pyelonephritis, causes a deep, aching, one-sided pain typically felt just below the ribs, often accompanied by fever, chills, and a burning sensation during urination. Kidney stones, on the other hand, can produce some of the most intense pain a human being can experience. Sudden, severe, colicky waves of agony that can radiate from the flank down into the groin. Here is how you can tell kidney pain apart from muscular back pain. Kidney pain generally does not change when you shift position, bend forward, or move around. It stays constant regardless of what you do. Muscular pain usually shifts and changes with movement. That distinction alone is worth filing away. Now I need to talk about something that is genuinely life or death important, and I want you to hear this clearly. In women, a heart attack does not always look like it does in the movies. The dramatic chest clutching, the left arm going numb. Those are classic presentations that are actually more common in men. Women frequently experience heart attacks with what are called atypical symptoms: sudden upper back pain, jaw pain, nausea, extreme fatigue, and shortness of breath, sometimes with very little or no chest pain at all. This is not rare. This is documented in the medical literature, and it is one of the primary reasons women's heart attacks are diagnosed later and treated less aggressively than men's. If you or anyone around you experiences sudden back pain in the upper region, along with breathlessness, sweating, lightheadedness, or any sense that something is deeply wrong, please call emergency services immediately. Do not wait to see if it passes. For women over 50, there is another critical cause to be aware of: osteoporosis. As estrogen declines during and after menopause, the rate of bone density loss accelerates dramatically. Vertebral compression fractures, where one of the bones in the spine partially collapses, can happen suddenly, sometimes with nothing more strenuous than bending forward to make the bed or lifting a bag of groceries. These fractures cause sudden, severe back pain, often in the mid or lower spine, and they are frequently dismissed as muscle strain in women who have not yet been screened for bone density loss. If you are over 50 and have not had a DEXA scan to assess your bone density, that is a conversation worth having with your doctor. And finally, we cannot overlook the role of the nervous system and chronic stress. This is not about dismissing pain as psychological, or quite the opposite. Chronic stress and anxiety cause measurable physical changes in the nervous system. A process called central sensitization occurs when the pain processing system becomes overactive and hypersensitive, amplifying pain signals throughout the body. Autoimmune conditions like lupus, rheumatoid arthritis, and fibromyalgia, all of which disproportionately affect women, involve this kind of system-wide inflammation and sensitization, and back pain is frequently a primary feature of all of them. Addressing stress is not a soft recommendation, it is a physiological necessity. Understanding the hidden causes of back pain is important, but knowing when that pain requires urgent medical attention could genuinely save your life. There are specific warning signs, red flags, that mean you should not wait for a routine appointment. You need to act today. Seek urgent medical care if your back pain is accompanied by a fever, night sweats, or unexplained chills. These combinations can indicate a kidney infection, spinal infection, or other serious systemic illness that requires prompt treatment. If your back pain wakes you up from sleep and does not improve when you change position, that is a red flag. Pain that is present even at rest and unaffected by movement is far more likely to have a serious underlying cause than ordinary muscular strain. If you experience any change in bladder or bowel control alongside back pain, difficulty urinating, loss of sensation in the inner thighs, or unexpected incontinence, please go to an emergency department without delay. This combination of symptoms can indicate a rare but serious condition called cauda equina syndrome, where nerves at the base of the spine are being compressed. It is a medical emergency that requires immediate surgical intervention. Back pain that accompanies unexplained weight loss, persistent fatigue, or a general feeling that something is very wrong warrants a thorough investigation. These are systemic symptoms that suggest the pain may be related to a wider process in the body. For any woman who has a personal history of cancer, new back pain should never be attributed to muscle strain without proper investigation, as it can occasionally represent a spread of disease to the spine. One final red flag that is critically important: if your back pain came on suddenly and feels like a tearing, ripping sensation, particularly in the upper or mid-back, please call emergency services immediately. This description is associated with a condition called aortic dissection, where the wall of the major blood vessel running through the chest and abdomen tears. It is rare, but it is life-threatening, and every minute matters. For everything else, pain that is uncomfortable but not catastrophic, pain that varies with movement, pain that has come on gradually, keeping a simple pain diary is one of the most useful things you can do. Note when the pain started, what makes it better or worse, where exactly you feel it, and whether it coincides with your menstrual cycle, stress levels, or changes in diet. That information gives your doctor something concrete to work with and significantly improves the chances of an accurate diagnosis. Here is something that needs to be said plainly. Medicine has a gender problem. For most of recorded medical history, clinical research was conducted primarily on male subjects. The symptoms, presentations, and treatment responses that became textbook standards were based on male physiology. As a result, the way many conditions present in women, including heart disease, autoimmune conditions, and pain disorders, was simply not well understood for a very long time. We are catching up, but we are not there yet. The practical consequence of this is that women's pain is more likely to be attributed to emotional or psychological causes without adequate physical investigation. A woman who reports back pain, fatigue, and pelvic discomfort is more likely to be told she is stressed or anxious than a man presenting with the same combination of symptoms. This is not speculation. It is documented in peer-reviewed research across multiple countries and healthcare systems. There are also common myths about back pain that persist in clinical settings and need to be challenged. The first is that if an X-ray is normal, nothing is wrong. This is simply not true. X-rays show bones. They do not show soft tissue, organs, inflammation, nerve involvement, or the vast majority of conditions we have discussed in this video. A normal X-ray is not a clean bill of health. It is simply information about one aspect of your spinal structure. The second myth is that back pain in young women is never serious. Endometriosis, ovarian cysts, kidney infections, and autoimmune conditions can affect women in their 20s and even younger. Age does not protect you from the causes we have discussed. The third myth is that if the pain comes and goes, it cannot be serious. Intermittent pain can reflect a condition that is progressing even during symptom-free periods. So what does an appropriate investigation for women's back pain actually look like? At minimum, it should include a thorough physical examination, a detailed history that includes menstrual cycle patterns, a urinalysis to rule out kidney involvement, and blood tests to check for markers of inflammation, infection, and organ function. Depending on the findings, imaging beyond a basic X-ray, such as an MRI or ultrasound, may be warranted. If a gynecological cause is suspected, a referral to a gynecologist is entirely appropriate and reasonable to request. You have every right to advocate for yourself in a medical setting. If you leave an appointment feeling that your concerns were not fully addressed, it is completely reasonable to go back, ask specific questions, or seek a second opinion. Some language that can help. I would like to rule out any underlying causes before we conclude this is musculoskeletal. Or, given my symptoms, would it be appropriate to run some blood tests and a urinalysis? Specific, informed questions get specific, informed responses. Let us talk about what you can actually do, both to find relief right now and to protect your back health for the long term. For immediate relief while you are waiting to understand the underlying cause, the old advice of complete bed rest has been largely replaced by evidence that gentle movement is actually better. Staying still for extended periods causes the muscles around the spine to stiffen and weaken, which makes pain worse. Short, gentle walks, careful stretching, and changing positions regularly are all more beneficial than lying completely still. In the first 48 to 72 hours after a sudden onset of back pain, ice can help reduce acute inflammation. After that initial period, heat is generally more effective for easing muscle tension and improving circulation. Alternating between the two is a strategy many physiotherapists recommend. When it comes to longer-term treatment, physical therapy is the gold standard for musculoskeletal back pain and has strong evidence behind it. A good physiotherapist will not just treat your pain, they will identify the movement patterns, postural habits, and weaknesses that are contributing to it and give you tools to address them independently. For women whose back pain has a pelvic or gynecological component, pelvic floor physiotherapy is a remarkably underutilized resource. The pelvic floor is a group of muscles that supports the bladder, uterus, and bowel, and dysfunction in these muscles directly contributes to back and pelvic pain in many women. Specialist pelvic physiotherapists exist in most major cities across the US, UK, Canada, Australia, and Europe. and a referral to one is worth asking about. If your back pain is related to perimenopause or menopause, the conversation about hormone replacement therapy is worth having with a specialist. For appropriate candidates, HRT can reduce joint inflammation, improve bone density, and significantly ease the kind of back pain that is driven by hormonal decline. This is a nuanced area of medicine that requires individual assessment, but it is a legitimate and evidence-based option for many women. On the lifestyle side, the evidence for Pilates and yoga in managing and preventing women's back pain is genuinely strong. Both disciplines build core strength, improve flexibility, and teach body awareness in ways that protect the spine over time. Swimming is another excellent option, particularly for women with joint or bone issues, because the water supports body weight while still providing resistance. Anti-inflammatory nutrition, rich in vegetables, oily fish, whole grains, nuts, and seeds, supports both joint health and hormonal balance. Adequate calcium and vitamin D are non-negotiable for bone health, particularly for women approaching or past menopause. Sleep position matters more than most people realize. Sleeping on your side with a pillow between your knees takes significant pressure off the lumbar spine. If you sleep on your back, a pillow under your knees achieves a similar effect. And if you spend long hours sitting at a desk, in a car, or otherwise, your workstation setup deserves a serious look. Hips should be level with or slightly higher than knees. The screen should be at eye level, and you should be getting up to move for at least a few minutes every hour. Finally, for stress management, and I want to say this carefully and seriously, managing chronic stress is a physiological intervention, not just a lifestyle nicety. Mindfulness, therapeutic support, adequate sleep, and social connection all reduce the nervous system's background activation level, which directly reduces central pain sensitization. This is not about telling you that your pain is in your head. It is about understanding that the brain and the body are one interconnected system, and caring for your mental health is caring for your physical health. There is one thing I want to leave you with, and it is perhaps the most important thing said in this entire video. Your body is communicating with you constantly. Pain is not an inconvenience to push through or a sign of weakness to apologize for. Pain is information. It is your body's most direct way of telling you that something needs attention. So many women have been conditioned by culture, by upbringing, by experiences in healthcare settings, to minimize what they feel, to say it is probably nothing, to not want to make a fuss, to keep going because there are children to care for, jobs to do, people depending on them. And so the pain gets normalized. It gets absorbed into the rhythm of daily life until it either becomes so severe it cannot be ignored, or it quietly causes damage that could have been prevented. You deserve better than that. Your pain is real, your instincts about your own body are valid, and you deserve a healthcare experience that takes both of those things seriously. If you are currently dealing with back pain that has not been properly investigated, take this video as your encouragement to go back and ask more questions. Keep notes, track your symptoms, bring someone with you to appointments if that helps you feel more confident. Seek a second opinion if the first one did not feel complete. You are not being difficult. You are being your own best advocate. And that is one of the most important things any of us can do for our long-term health. Back pain is common. But common does not mean it should be ignored, and it absolutely does not mean it has to define your life. With the right information, the right support, and the right care, most causes of back pain in women are treatable, manageable, and in many cases entirely preventable. You now know more about this topic than most people who will never watch a video like this. Use that knowledge, share it with someone who needs it, and the next time your body speaks up, listen.